I welcome all of you in this program on patient safety. All of us are working in healthcare organization, whether we are working in laboratory or we are working in hospital or in clinic, everywhere what we want, better outcome of the patient. For this better outcome of the patient, it is very important. Patient is not suffering any harm. Whatever is not expected, that is not happening. So for this, we have to keep in mind certain things. What are these? That we will discuss. That we will discuss. Requirement related to patient safety. So first, we have to develop a framework. What all we will include in this patient safety when we want to address this aspect in our healthcare organization. See, one thing is organization shall have documented processes. What do you mean by process? Sequence of activity. There are many areas where a error can result in compromise in the patient safety. So we have to develop processes at various places. These are decided by the organization. There are certain guidelines, certain things are decided by the organization because we want to ensure proper care of the patient. What are these key areas? Like patient identification, whether it is some diagnostic process, it is some surgery, or it is just a prescription of a medicine or delivery of a medicine, or in medication safety, what all we have to see is surgical safety, what all need to be addressed. Infection control is very important, diagnostic safety, and when person is in the hospital, certain things like prevention of fall, prevention of thromboembolism, prevention of pressure ulcers, that also shall be avoided. So all these things contribute to patient safety if these are addressed properly. So these are various issues related to patient safety, which I just enumerated. There are many more. So now we have to see which safety issue we want to address. If suppose there are some national, international guidelines, so that shall be followed, and standard references you can follow, and based on your experience, you can develop certain guidelines. So we have to see doctor-patient ratio, nurse-patient ratio, doctor-nurse ratio. You are fulfilling the, if there are some guidelines, you are fulfilling those guidelines, and depending on your workload and the kind of workload you are getting in your healthcare organization, you are developing workforce. And everywhere, teamwork is very important. So you have to develop team-based workflow. They are working in coherence. It applies to referral system also. You have to transfer a patient from medicine to ICU. For this, a teamwork is required. You have to transfer a patient from OT to again ICU, or from ICU to ward, or you have to send some simple patient for MRI. For all these things, you shall have a well documented system. And suppose you are working in a small setup, you want to refer a patient to cardiac center, or maybe for some advanced care, advanced neuro center. So what is the system of referring patient there so that there is no compromise? Ambulance has required facility, there shall be some checklist, what all you will check. And also, if you are working in a tertiary care organization, you are getting referral from the different areas, how the patient will reach to your organization. What are the guidelines? Inform concerned hospital or clinic setup appropriately so that there is no compromise, because they may not be knowing. You are expert, you know all these things. And also feedback is also very important from patient. their attendants, what is their experience in the organization, if they are transported from a particular hospital to your tertiary care, or you are transporting from your hospital to a tertiary care institute, what is their experience about the journey? If you are finding certain challenges, so you can take appropriate action on that. And whenever you're referring a person to any institution for receiving, you must understand what are the expertise and capacity of that institution. Then you shall have a system for critical incident reporting. There may be many things. A first thing is, what is this critical incident? Something which is unplanned, unanticipated, or not scheduled. Some event which may cause death or serious harm to the patient. Suppose surgery is performed on the wrong side. A medication is given to a patient. What I mean to say, medicine is given to wrong patient, or some medicine is not provided to a patient. So there are many things, but what is thing? Whatever is unplanned, unanticipated, not scheduled, and which can cause some harm to the patient. So we have to develop a system for recording all these things. There are 7 strategic objectives when you are developing framework. You can download from the website. There is a very good document. This is Global Patient Safety Action Plan 2021 to 2030. You can download from website. And there is all, because these days globally people are facing challenges and they are thinking about this quality. And India has also developed a document, National Patient Safety Implementation 200, 2018 to 2025. These are very good documents. So you can refer to these also. What is required? These 7 strategic objectives. First I am enumerating, then we will discuss one by one. Policies to eliminate avoidable harm in healthcare. Policies to eliminate avoidable harm in healthcare. High reliability systems. Safety of clinical processes. Patient and family engagement. Health worker education, skills and safety. Information, research and risk management. Synergy, partnership and solidarity. Now, what is required? One thing is, as I said, policies to eliminate avoidable harm in healthcare. Now we are discussing this part, policies to eliminate avoidable harm in healthcare. For this, you shall have patient safety policy, strategy, and implementation framework. This aspect is very important. For this, you shall have adequate human resources and sustainable finances, and you shall have proper annual budget. In this case, some actions are required at the government level. Some actions are required at the healthcare facility level. Some actions are required at the stakeholder level. What is required at the government level? Patient safety shall be recognized as health priority. It should be developed as essential component. If we will talk about patient safety, only then we can talk about all these advancements. These days, people are talking about so much advancements, robotics in different aspects in healthcare. We are talking about artificial intelligence. We are talking about approve, technical improvement, technical excellence. All these things are important only when we are considering patient safety as essential component and we are providing priority to this component. So for this, we have to develop, when we say we have to develop, government has to develop National Patient Safety Program, and they have developed in this National Patient Safety Implementation Program 2018 to 2025. And also, country shall work in collaboration with other countries. What all they are developing, how we can incorporate certain things. In certain things, we are guiding them. When we will work in coherence, we will work with the cooperation of each other. Only then we will be able to develop some global policy. There is improvement in the healthcare all across the globe. Whatever technical advancement we are developing, but suppose infection is not controlled properly, then what will happen? There is no advantage of all this development. Government has to adapt WHO patient safety technical guidance. As I said, there is WHO document also 2021-2030. Healthcare also they shall have a commitment towards the public. Whatever processes they are developing, they have to see they are fulfilling the requirement of patient safety. Then resource mobilization and allocation. So this is required at government level. Adequate human resources and sustainable finances for this national patient safety plan. If suppose there is only plan but resources are not provided, then nothing will happen. They have to develop annual budget also. And healthcare facility, they also have to see they are providing adequate resources. They are developing some planning. They have annual budget for this safety implementation. And also, staff shall be trained. There should be training for everyone working in the laboratory and working in the laboratory or hospital, how they will address all these things. Then some regulation also shall be there, some law also shall be there to facilitate this formulation and implementation of patient safety policies. And also, when we are developing this patient safety, we have to see we are developing a law to protect health workers from retaliation or punitive action in case of reporting an adverse event. Suppose somebody is reporting and that person is penalized by that organization. So other people will not come forward to report any adverse event. So they have to develop some system. Government healthcare facility also have to see in this aspect safety standards. You are developing, like as I said, WHO has developed a document, and we have to develop certain regulations also. In this, we are developing minimum patient safety standards. And we are developing accreditation also. In accreditation also, we are addressing patient safety requirements. And for small organization, develop some minimum safety requirement. This should be there. In every organization, there is no compromise. If suppose you are developing this biomedical waste management guidelines, This is also one of the safety measures. Accreditation, although this is voluntary, but people who are coming forward, they shall be encouraged. This is also a patient safety measure. Can anybody tell me when World Patient Safety Day? When is this World Patient Safety Day? Anyone, please write in the chat box. World Patient Safety Day is on September 17th. Dr. Ravi Kumar, it is September 17th. Yes, Kuldeep Rawat has written correctly. On this day, in many countries, organization they develop some national campaigns to promote this World Patient Safety Day. If suppose you are promoting health hygiene, although there is separate day for health hygiene, but if you are promoting that, what you are doing, you are reducing possibility of harm to the patient. So government has to see they are developing some national campaigns on the World Patient Safety Day. They are launching certain things to promote patient safety. Healthcare facilities are also coming forward to promote various things. Then high reliability of the system. There should be transparency. There shall be openness. And again, motivation and action is required at all levels. At the level of government, at the level of WHO, that means international level, national level, state level also, state government shall come forward. Then at the level of organization and patients, other people working in the organization, they also have to come forward. They are also promoting this. They are not only service receiver, they are also part of the organization. If suppose they are not following guidelines related to cleanliness, and a lot of visitors are coming to see a patient, unnecessary they are spreading infection. From that hospital, they can catch infection and then it will spread in the community. So patients also have to see they are following proper guidelines. In this high reliability system, when we are building, so there should be culture of respect. Everyone should be treated with respect. People who are working in the organization, people who are visiting the organization from some services, there shall be transparency in the system. Whatever guidelines are there, it is clear to everybody. There should be openness. They are recipient to ideas promoted by different persons, and there is no blame culture. If we are able to develop this no blame culture, only then the quality will improve. And we have to see what is the difference between medical error and medical negligence. Can any of you tell me what is the difference between medical error and medical negligence? Check from the Google and then ask me to unmute you. I will unmute you. So one thing is what is required. There is a system in every organization. Whether system is not good or system need improvement, but there is a system. The people should come forward if someone is guiding to change that system. If it is for the betterment of the organization, if it is for the betterment of the patient. Sometimes we are very rigid in our thoughts. We don't want to change. So when we don't want to change, the quality will not improve. So this government has to see, healthcare facilities also has to see, and people who are working in the organization, people who are visiting the organization, they also have to see all these things. Now, good governance for the healthcare system. You are developing a patient safety officer. One thing is at the level of government. They are in the Department of Health Care, Ministry of Health and Family Welfare. They are developing a system to monitor patient safety in different organizations. And during accreditation also, this is given priority when we are providing registration to various healthcare organizations through state government. So this aspect shall get the priority. And healthcare facility also are required to see they are appointing someone who is taking care of this patient safety, and they are developing patient safety committee. In these various aspects are monitored and discussed. And a good leadership is very important. A good leadership who can take people forward, a good leadership capacity for various clinical and managerial functions. In this, you are appointing a senior officer who is building this patient safety leadership system. So everyone is feeling happy. Yes, they are contributing in the organization. That person is encouraging other people to come forward and work towards the patient safety. And WHO Secretariat can also develop a laboratory leadership competency framework. So because if something is happening at the WHO level, same thing is communicated to different countries, and through different countries to different healthcare organization, and some if every healthcare organization is following the similar system, then there is harmonization in the thought process, in the implementation process. Patient safety is very important in emergency situation. In the setting of extreme adversity, suppose there is flood, there is earthquake, or some other happening, some infection spread, or emergency related to individual. In all these things, we have to see our system is developed in such a manner that patient safety is not compromised. This we have to see at the government level. If suppose there is any situation, there should be some provision of ambulance, and also should be done at the government level. They are finding, they are identifying risk areas where a patient safety is compromised. They are keeping record of that and how this can be mitigated. These accreditation bodies, government, which is providing registration, they are inspecting the organization. They can also see what are the health compromises they are finding in a particular organization, which can create compromise in the patient health. So how to mitigate that? And they're keeping record of that, maybe some register. And Annually they are providing some guidelines. See, these are the possibilities which may happen in any organization and you have to take action. These are the possible action in this. Then people will monitor those activities. They will be able to reduce the possibility of that occurrence in their organization. You are carrying out so many clinical processes in your organization. So safety of these clinical procedures is very important. To again, something is required at the government level, how a risk can be avoided in a particular situation. So in this, the government has to develop some patient safety improvement programs, which is consistent with National Patient Safety Plan and Strategy. In this thing, patient identification, diagnostic safety, or certain patient group, pediatric patients, dementia patients, or healthcare setting. Every healthcare setting, they have different challenges when they are carrying out certain processes in their organization, like primary care, nursing homes. Their challenges are different from the challenges in the tertiary care hospital. You are providing cannula to the patient, possibility of thromboembolism is there, patient may fall. We will discuss all these things. So, how to develop safety in this risk prone areas. So, for this proper guidance and leadership support, and we shall have annual patient safety improvement programs. When we are carrying out these programs, to evaluate also, these are actually serving some purpose. And you can provide some written notes also to different sections so that whenever they are free, they can refer to this or in case of any requirement. So this should be done at the government level. This shall also be done at the healthcare facility level. A leadership group, they are checking, they are providing priority to this annual patient safety improvement program. They are identifying some clinical service areas where patients, they are focusing on patient safety improvement, identifying all risk prone procedures. Like that, you have to see. And then infection prevention and their control. And also, this antimicrobial resistance is very important. All of you are facing these challenges. Many times organisms are resistant to most of the commonly prescribed antibiotics, but sometimes we prescribe very high-end antibiotics for routine infection. This carbapenem, colistin shall not be prescribed for every second or third person. And we are taking care of biomedical waste. We are taking care of this hand hygiene aspect. All these workstations are properly cleaned. This shall be promoted at the level of government, at the level of healthcare also. And this is the responsibility of people working in the organization and they're taking services from the organization. Then you are, and these patients, they are receiving, they are, suppose you're inserting Foley's catheter or else tube, we are providing different medicines, they are receiving blood or they are receiving vaccine. So you have to see they are not developing any harm from all these things. Some transition in care, there is duty shift and certain orders are not passed correctly, or polypharmacy. Some national experts should be there, a multidisciplinary task team, which are providing guidance and action plan. They are providing for patients and public some guidelines for how to use different type of medicines, guidelines for healthcare professionals, and enhancement of knowledge of patient is very important. Awareness and knowledge about the medicine and medication use, and patient role in managing their own medication safety. One thing is, nurse shall be very careful, but you tell patients also. If suppose even if somebody is not very literate, but still at least this much that person can understand. Ki you have to take this medicine 4 times in a day. They can keep a watch on that, or you have to take these many tablets. So even if somebody else is providing, but they are understanding, yes, okay, this is provided adequately, or there is some compromise. Depending on the level of their understanding, you can make them also part of the care. Patient, as I said, patient and family engagement is very important. When you are developing policies, you are developing programs with the patient, engage patients' families in these policies and programs. This is required at the government level, how this patient shall be educated, because there are different type of patients. Maybe you can involve patient or their families in the rehabilitation program. So ultimately, what is required, we have to keep in mind safety of the patient, respect of the patient, autonomy, and the care which is we are providing is of appropriate quality. So same thing is required at the healthcare organization level also. And if you are developing some strategy for patient care, involve patient and family also in that strategy. Learn from patient experience also. Somebody is diabetic or Parkinson disease patient or patient of stroke now recovering. What are the challenges they are facing in their care? So with that also, you can develop some system, you can strengthen their care system. And whatever challenges they are sharing, you are making part of, you are making this challenge part of their management. So this patient safety is very important. When you're developing any system, you have to see the patient will also feel happy and you can make certain people responsible for this. You can develop some counselor also. You can some who are guiding patients also, and they are listening to patient. When patient is admitted, so some in addition to doctor, some counselor is taking around and they are discussed with the patient. What are the challenges you are facing, or can you guide something? So whatever they are facing, guiding, in the end, this treatment can be individualized for a patient. If suppose you are providing lunch in the hospital at 1 o'clock, and somebody for the last many years is in the practice of having lunch at 12 o'clock, and now the patient is feeling very hungry, and you're saying you will get lunch only at 1 o'clock. So if there is opportunity for patient to share his or her concern with some person, so they can share and appropriate measure can be taken to address his query. So for this, for everything, because there are many challenges. Some similar type of challenges are identified at the global level, certain things at the national level, certain things at the patient level. So strategies shall be planned at various levels so that in the end there is no compromise in the healthcare. And information shall be provided to the patient regarding their diet plan, regarding importance of taking medication on time. All these things are important. And if there is any challenge, suppose there is some incident, as we discussed critical incident initially, so there should be some national guidance and keep record of all this incident. And healthcare facility also has to see if they are taking appropriate action on that. If there is any incident, they are keeping record of that and appropriate action is taken on that. And if there is any such incident, patient, family, and also health workers, these are given proper psychological and other support. Now, to carry out all these things in a required manner, what is required? Proper education of the healthcare worker. We have to develop certain skills, and they shall understand if this patient safety is very important. What is the purpose of a patient coming to a healthcare organization? They want correct treatment, that correct treatment within reasonable time frame. An outcome of that treatment shall not cause any adversity to the patient. So every healthcare worker shall understand this. They shall be educated about this. Patient safety in professional education and training. So what we can do at the level of government, this shall be included in the curriculum of the MBBS, of the post graduation. MD or MS in the super specialty, DM or MCH. This shall be included in the course curriculum of nursing staff. This should be included in the course curriculum of various other supportive staff, OT technician, radiology technician, laboratory technician. Everywhere this should be included in the education, and also they shall be trained. First, you are training them how to perform this hand hygiene. Then they are further promoting this. What are the areas where this hand hygiene is important? Then they are further promoting this. So this is required at the government level. You are making this part of the curriculum. And WHO is also developing some programs. They are also developing patient safety curriculum, which government of different countries they are adopting, and they are conducting some programs through different NGOs or through different other organizations. It is the best interest of the patient. This shall be included by the healthcare facilities also. Some induction and orientation program. When a person is joining, so you are telling this is our system of keeping in mind patient safety. And in some areas, one thing is a general induction and orientation program, which is for everyone. But depending on the type of work a patient is involved in, some specialized training on patient safety. Suppose somebody is in MRI, you have to tell him, see, it is in the interest of the patient. All iron objects shall be removed. Somebody is in the OT, so this precaution shall be followed. Like that, you have to keep in mind. So this should be included in the curriculum and training general as well as advanced training in some area. And also encourage your staff to take online and on-site courses on patient safety as a part of continuing professional development. These days, this online platform is a very good platform. You can attend courses of your colleagues. You can attend courses offered by different NGOs, courses offered at the country level, or maybe some international university. You may attend some program promoted by Harvard University or John Hopkins Hospital. So now there are so many opportunities. So if we work towards this, so definitely we can improve. Now, patient safety competencies. What is competence? Ability to use acquired knowledge and skill in practical situation. So, evaluation of this competence, person who is working in the healthcare organization shall be competent to perform various activities, whatever he is involved in. This shall be regulatory requirement. There shall not be any compromise in this. If suppose somebody is performing cardiothoracic surgery, person shall have competence. If suppose somebody is performing testing in the laboratory, shall be competent. For this, a minimum basic education requirement shall be promoted at the level of organization, and also some training. Then you are linking patient with appraisal system of health workers. What is the meaning of this? Can any of you tell me? What is the meaning of this statement? Linking patient with appraisal system of health workers. See, what they are trying to say, At the level of government, this shall be promoted. People who are participating in different patient safety programs, so they are provided with special incentives as a marker of esteem. You are recognizing their exceptional achievement if there is demonstrable involvement in the in some program where there is improvement in the patient safety. And this shall be done at the level of organization also. For healthcare workers also, people who are working in the laboratory, there should be some initiative at the government. There is a WHO initiative also, the WHO charter, health worker safety, a priority for patient safety. The government is adopting this and they are developing some national program to address the occupational health and safety of health workers in line with the national policies. And it is done at the level of healthcare facility also. They are taking care of safe working environment in terms of working hours. They are getting rest in between rest break. And burden on healthcare, health worker is minimized. So there is no burnout. They are feeling overall well-being, vaccination of the health workers. And you may be wondering why we are talking about in between health worker safety, because the topic today is patient safety. See, if one thing is health workers are also human beings, otherwise they will become patient and then we will talk about patient safety. So if whosoever is connected with the healthcare organization, so we are talking about the safety of everyone. If someone is healthy, properly vaccinated, they are not burnout, they are feeling overall well-being, only then they can work towards the patient safety in an effective manner. You are providing them with the proper personal protective equipment and everything is properly functioning, and even these chairs, work table, all these are ergonomically designed. So that means these are not adversely affecting their health. Now, information and risk management, you shall have some system for patient safety incident reporting. This should be done at the government level. You shall have incident reporting system. And एक तो patient safety incident reporting, patient safety information system, ki how we are generating surveillance, then patient safety research programs and digital technology for patient safety. What is required in this? When we are developing patient safety incident reporting and learning system, what are the different areas where a compromise may be there? Where a compromise may be there, patient safety incident. So this is important in both government and private healthcare sector. Government has to see they are strengthening existing system. For this, there are certain WHO reports also. And some action is required at healthcare facility level also. So they may follow WHO guidelines and create user-friendly, confidential, and effective reporting system. If someone is reporting something, keep that information confidential because this is important. Any incident, some medication error, some surgical error, some diagnostic error, so these incident, if someone is reporting, to keep record of that appropriate action and maintain the confidentiality also. Then patient safety information system. Patients, they are reporting their experiences. This is important. You are reviewing medical records. You may find some deficiency in the care of a particular patient. Burden of harm studies, safety surveillance data of blood products, medicine, vaccine, medical devices, and prepare a annual report and develop a set of indicators for patient safety aligned with global patient safety targets. So you are developing some indicators also. You will monitor these. And see in your healthcare organization what you are is achieving and generally what is achieved at the national level. And in this design accountability mechanism also. And also develop some mechanism कि ultimately there is improvement, there is progress in reducing the harm, and patient safety is improved in any healthcare organization. You are monitoring properly patient safety practices and you are assessing the progress. Government is analyzing and prioritizing areas where some research work shall be performed so that we are developing more knowledge about the situation and we can avoid harm. And ultimately, there is reduction in the harm at the level of country, in the country's healthcare system. And you can also see in this research work there is sufficient capacity, skill, and resources to meet the country need for patient safety research. What I mean to say, if suppose you are observing a tertiary care hospital, there you may not find any compromise in the healthcare. But at the district level, at the primary healthcare level, you're finding there is less number of people, resource persons are less, their skills are limited, they have less number of other resources in terms of machines, in terms of beds. So then you can develop some national data. You can develop some national data and help the government in developing their policies. And it is important at the level of healthcare organization also. They are developing policies, they are developing programs. Sometimes you will find very big organizations, top organization of the world, top organization of the country. They have all advanced facilities. But how the patient will be transported from emergency to a particular ward, that system is not properly developed. If suppose you are developing very advanced surgery center in surgery, sometimes in case of malignancy or other reason, they may have to go for frozen section. And it is taking too much time for this frozen section specimen to reach the laboratory. Whatever advanced mechanism you have, but it will create some compromise. So if we are carrying out some research which may lead to some in areas which may lead to some compromise, and if we are taking appropriate action, patient safety is improved. So that research will give you more meaningful information rather than some rare marker in a particular malignancy. I'm not saying that is not important, but this patient safety is very important. So healthcare facility also they should see and they should regularly look for improvement in the patient care. They should consider themselves a partner in this research work. The nowadays we are talking a lot about this digital technology for patient safety. So we shall have national strategy. With this digital technology, record keeping has improved significantly. To promote and support digitization of healthcare processes, as I said, such as medical records, electronic prescribing. Previously, what we used to do, and right now also in many healthcare organizations, or most of the healthcare organizations, if suppose we want to have medicine opinion in a case of preeclampsia, the obstetrician wants medicine opinion in to control the hypertension. Previously, what used to happen, they are writing in the case sheet, then case sheet is going to that clinician, the clinician is making a note on that, yes, noted, and then after some time they are called again. But if you have some digital technology, if medicine consultation is required, so with the press of button, a message is going to that clinician, and you have information. The person has accepted that, and if there is a system in the organization, whatever referral they are accepting, that shall be completed within 1 hour. And if they are pressing button, yes, they have seen the reference after 1 hour, maybe 1 hour 30 minutes. Then this is monitored, and at the end of month, you are finding out how many references were seen late, and they have to tell you the reason for that. This may be a quality indicator. So that way we are working towards patient safety. So this is required at the level of government. You shall have national strategy. So we have to invest resources in the digitization of end user health services. That is patient. We can develop telemedicine. We can develop diagnosis. Ultimately, there is promotion of health and prevention of some harm. This is also required at the healthcare facility level. They are coming forward to incorporate this digital technology in their system. Then, stakeholder engagement. What do you mean by stakeholder engagement? Who are benefited? Involving different persons who are affected by these services at the level of action, at the level of government, They are developing some policies. They are involving, suppose they are conducting a meeting, a health ministry is holding a meeting, some conference with the owners of different healthcare organization. They are discussing with them how we can further improve and advance patient safety. So what all can be incorporated in the, or they are taking the help of different organization, maybe in India, Indian Medical Association, Delhi Medical Association, different state medical associations, different specialized organization like organizations of ophthalmology, pediatrics, medicine, surgery, pathology, radiology, and they are formulating some policies. And similarly, at the level of healthcare facility, they are conducting some meeting of different departments and they are formulating some policy for themselves. Like that, some stakeholders engagement. With that, there is common understanding. They are understanding, yes, this is important, how each of them can contribute in improving patient safety. This can be done within the organization, all organization, within the city or in different geographical areas. So different, so that way patient safety and whatever other technical programs you are developing to improve the technical aspect. So this can be done in alignment with those programs. So there is no need कि we have to discuss patient safety separately. What all contributes to patient safety? We are talking about patient safety. Different actions are required at different level. So we understood one thing: teamwork is very important. Communication is also very important. And whatever we are getting, suppose we are conducting some surveillance, we are generating some, monitoring some activity. It should be evidence based. Through our experience, a good learning, through different conferences, seminars, a good learning leads to improvement in the patient care. It requires a good leadership. And whatever we are doing, we have to keep in mind everything is patient centered. We are keeping in mind patient improvement. Teamwork, what is important in teamwork? Everyone should be clear about the goal of a particular team, what you want to achieve. Then mutual respect for each other. It is not like that, ki whatever I will speak, everyone has to listen and everyone has to say yes. Supportive. If suppose you are floating some idea, other people should listen to that carefully and then should discuss their concerns rather than criticizing your suggestion. Same is true for every one of us. If somebody is suggesting something, so you give your idea rather than criticizing. No, this is not correct. This should not be done. This will not give you any result. Not like this. You tell your concerns and reach to a conclusion. And everyone, whatever they are saying and how they are working, watch carefully. When I'm saying watch carefully, because when it is teamwork, you will meet frequently. So in the next meeting, you can discuss. You will learn certain things from them, and certain things which are not clear to you, you can discuss with them. Ki, what is the reason of carrying out this activity in this manner? Very politely, keeping in mind respect of the person, you can discuss and ultimately you will achieve your goal. What do you mean by goal? Anyone? What do you mean by goal? See, you are playing football. What is your aim? Vishwarup Das, please unmute yourself.
Yes, good morning, sir.
Good morning. See, suppose you are playing football. In your
Okay.
team, you have 11 players. You are working as a team. As a team, what is your aim in the football? You don't want other team to put a ball in your goal, right? And you want to send ball in their area. That is your ultimate aim. Am I right?
Yes, right, sir.
So whatever you are doing, your aim is you send a ball to their area, and if a ball crosses between those two bars, that line crosses that line between those two bars, you call this is as goal. That is your aim. Whatever you are doing, you are sending pass to someone, you are running, whatever you are doing, you are developing your fitness level to play in the team. Everything is related to that. That ball should cross that line between those two bars. Am I right? So,
Yes, right, sir.
similarly, as a team, what you want to achieve? Suppose this team is designed for patient safety. So, ultimately, there shall be improvement in the patient safety. This is your ultimate goal. In your football, if you want to avoid, the ball should not touch your hand when the play is in progress, because that is a foul. That will create some adversity for your team. So you want to avoid that situation. But same thing you don't want to avoid if you're playing cricket. If ball is coming to you, you will stop ball by your hand. You will not try to stop with your foot. You will try to stop with your hand. But you will not do the same thing in your football. So what I mean to say, we have to understand the ultimate aim of a particular activity, and when we are achieving, so we say this is our goals, similar to when we say goal in our football or hockey, ki whatever activity we are carrying out for that purpose shall be fulfilled, right?
Right.
And in our communication there shall be transparency. Whatever we are saying, there should be transparency in that and clarity. If we say a security guard कि unwanted person shall not enter in the organization. What do you mean by unwanted person? What is the authority you are providing to that guard to stop a person? Handoffs. Handoffs means you are telling some other person to perform some activity. Make them provide that person some authority to take the decision. That person is telling someone else. That person is getting some authority. So with authority, they will feel responsibility also. If suppose you are telling some other person and you are trying monitoring is one thing, controlling other is another thing. But if you are controlling other person for each and every minute activity, then the person will not be able to develop himself or herself. They will not be able to develop the ability to take the decision. So, what we have to develop? We have to develop leadership in our organization without compromising any rules of the organization. In between, we are sending a link in the chat box. You fill that link and submit to get the certificate. Evidence based, everything. It is the best practice and it is outcome driven. We are working towards zero defect in our organization. This is what we want to achieve. There are various ways of learning because if we are not learning, that means we are deteriorating. We have to come forward to learn continually. So we shall have awareness if we are involved or if organization or government is involving us in some activity, awareness. What is the purpose of this? And how to carry out, how we can improve the performance in this. And if we are finding something which is not acceptable, so how we can reduce the possibility of that unacceptable. After root cause analysis, we take action. Root cause analysis, we are trying to find out the reason for that. It should be blame free. If suppose somebody is saying this happened in ICU or this thing happened or this patient fell from stretcher, you are saying, oh, then you will be penalized. Why you were so careless? So what I mean to say, you shall have discipline, but if somebody is saying something, it should be blame free. They should be free to disclose any unacceptable, non anticipated happening in the organization. They shall have trust in you. You shall have trust in their ability. If there is any compromise in the ability, develop their ability. So they are not finding any risk or their behavior is not imposing any risk for your organization. These days, you will find a lot of lectures on developing the quality of leadership. What is required in leadership? One thing is commitment. You are committed. You want to improve the services. As a leader of a particular activity, as a leader of the organization, you are committed toward that. And out of all the thing, if you have taken some responsibility, that shall be your priority. Or if you are providing something to someone else to perform some activity, adequate resources shall be allocated for that. Promote yourself, show yourself as role model. People will say, yes, this person is following the system, and we also have to follow the system in his or her manner. And as a leader, you shall always be supportive to other persons working in your organization. We have to see all our activities are patient centered. We are conducting meeting, we are deciding some actions, we are taking some actions. Whatever we are doing, we have to see ultimately it is beneficial for the patient. There is improvement in the patient services. If there is improvement in the patient services, health is promoted, and as a person working in the healthcare organization, we are ultimately contributing in the better care of the patient. Patient identification is very important in every area, at all points of care, whether it is some diagnostic process or therapeutic procedure. Suppose you have to put Foley's catheter or Ryle's tube, or you have to perform some minor surgery or maybe tooth extraction or some major surgery. Everywhere, correct identification of the patient is very important. Or you are transfusing blood, you shall have at least two unique patient identifiers. There is an ISO document recently released, ISO 7101. That is the that is for all healthcare organization, not laboratory, all healthcare organization, how to develop quality in healthcare organization. So they say you need two unique patient identifiers. You can say name and CR number. With that, we will identify the patient. It is okay. But do not use patient's room number. Ki Ram Prasad room number 306. Or patient room number, bed number, or location in healthcare facility. Don't use these for the identification. These you are noting down for identifying where a particular patient is located, but it is not the patient identifier. So this you have to understand. This information is important, but to locate the patient, not to identify the patient. And also develop processes for special circumstances when a patient is unable to confirm their identity. Suppose there is some comatose patient or disoriented patient, patient is in delirium, or patient is neonate. Up in neonate, there is no legal name of the that particular patient, patient of severe burns. So how you will identify? We are saying, okay, we will put some handband, whatever you are doing. So that way you shall have some system of patient identification. Medication safety is very important. Medication safety is very important. You shall have documented information regarding medication processes. The standard is saying you shall have processes, you shall have sequence of activity, and how you will perform these activity. You shall have further detailed information or procedure for that. And this shall be written down somewhere. Documented information regarding medication process. So you shall have process and how you will carry out various activity of the process. Some details about that, and that shall be written somewhere. This process shall include medication choice. First, doctor is deciding what medicine I want to give to this patient, prescribing medicine, procurement, pharmacy validation, preparation, storage, dispensing, administration, to further detailing at each step. And to ensure medication safety, organizations shall create a list and establish guidelines for the use of high-risk drug and implement an alert system. These days, sometimes there are some lectures on this. Certain medicine are called look alike, or certain medication sound alike. Name is very much similar to each other. Concentrated electrolytes, insulin, anti-neoplastic drugs. So you shall have a list and guidelines ki how these will be prescribed and how these will be stored in the institution. Rational use of antibiotics. So This itself needs a full day discussion at least. Rational use of antibiotics. If there is rational use of antibiotics, then chances of antimicrobial resistance is reduced. Maintain protocol in place for patient and caregiver education regarding patient. This doctor or care provider shall not be in a hurry when you are telling a patient, see, this medicine you have to take 4 times in a day, this 3 times in a day, or it is before meal or after meal, or this should be taken in this way, with lot of water, or you shall take this medicine when you are sitting or standing, not lying down. So that way, the patient or caregiver shall be educated about that. And monitoring and reporting of medication error or medication related adverse event. So this shall be reported and appropriate action shall be taken for that. So how you are ensuring medication safety? Monitoring medication error. Here monitoring adverse drug reaction. Patient counseling is appropriate. You are developing standard treatment guidelines and you are developing policies for antimicrobial use. You are saying if a patient is coming and infection is suspected, empirically these antibiotic will be started and it will be changed after getting culture and antibiotic sensitivity report. And periodically, we are developing our antibiogram. For 3 months, here we are evaluating cultures, and then we are deciding for the next 3 months we will use for gram-positive cocci empirically this group of antibiotic, for gram-negative cocci or gram-positive bacilli, so that way you are developing your antibiotic policy. These are the common causes of medical errors. See, all these things creates compromise in the patient safety, inappropriate prescribing, lack of knowledge about the drug, carelessness, heavy workload, absence of SOPs, look alike and sound alike drugs, poor documentation and transcription, lack of communication, non-standard time of drug administration, not taking history of allergy, poor handling, poor handing over and taking over of charges, inadequately trained personnel, all these things can cause medication errors. See, we said laboratory shall have a process. So when there is a process, there is flow of activity. Procurement, storage, prescribing, indenting, dispensing, administration, disposal. You shall have a process and further detailing at each step so that there is no compromise in the medication. Right? Sometimes there is verbal order. So what is the process for that? This is also important, starting a medication. So you have to explain. Sometimes patients certain thing. If it is suppose prazosin, so you know there is first dose phenomena. When you're taking medication, what you have to see, if you're adding a medication, you have to see they are not already taking something which shall not be taken together. There may be some disulfiram like reaction or some other side effects. If these two medications are taken together, periodically you're reviewing medication. If you're stopping, then also you have to see steroids shall not be stopped abruptly. Those shall be tapered. In certain other situations, there may be some other guidelines. So all these things contributing to, if properly addressed, improvement in the medication safety. If not addressed properly, compromise in the patient safety. So All these are different chapters of standard. So they themselves take a full day discussion. So here what we are doing, we are telling you what all can cause compromise in the patient safety. So these are the different aspects. And regularly we will plan some other lectures where every single step will be discussed in detail. Now in surgical safety, what is important? We have to see safety measures in the operation theater and other areas where a minor surgery is performed. So there shall be a sufficient workforce, nurse, physician, and other healthcare workforce. We have to define infrastructure in such a manner that there is no compromise, and evidence-based practice for the delivery and monitoring of anesthesia, a good communication and collaboration between surgeon and anesthesiologist, necessary equipment for patient monitoring during surgery shall be there. And if there is some surgical intervention, analyze periodically and also see if there is post-operative readmission is required. What is the reason for that? And maintain processes to prevent wrong patient, wrong kind of surgery or wrong site of surgery, wrong patient, wrong kind or wrong site of surgery. So all these things contribute to surgical safety. Then you shall have surgical safety checklist before induction of anesthesia, before skin incision, before patient leaves operating. Has the patient confirmed his identity? Before anesthesia, confirm patient identity. Also, where exactly the problem is, site, and also whether you have taken the consent or not. Is the site marked? Is the anesthesia machine and medication checked completely? Pulse oximeter is functioning. There is no allergy to the patient. There is no difficult airway or aspiration risk. This is before induction of anesthesia. Then before skin incision, confirm all team members have introduced themselves by name and role. Anesthetists know who the surgeon is, and surgeon knows who is the nurse, who is the anesthetist. Confirm patient name, procedure, and where the incision will be made. If suppose some antibiotic prophylaxis is required, whether it has been given or not. Anticipated critical events shall be explained to surgeon, anesthetist, and nursing team. First, they are discussing. And if suppose some X-ray need to be displayed, CT scan, MRI need to be displayed, whether these are displayed or not. Check all these things. Then you're performing surgery. Before patient leaves operating room, nurse is confirming, okay, we have performed, or doctor is confirming, we have performed this procedure. We have removed his gallbladder, or we have performed this cesarean section, and with this we have also done this tubectomy. So they are confirming the procedure. Then completion of instrument sponge and needle count. If some specimen is removed, proper labeling of the sample. Or if you have faced any equipment problem, so you are discussing that also. And key concerns for recovery and management of the patient. Certain things need to be monitored, suppose for next 12 hours or 24 hours. So there only you are saying whether these appropriate notes have been documented in the case sheet or not. Infection prevention and control. Again, this is a very big topic. What we need to see in this, laboratory shall have documented and coordinated processes. Process means sequence of activity for an infection prevention and control program. Infection prevention is very important. If there is an infection, proper control of that infection, and why it is important. Who is microbiologist in this group? Any microbiologist attending this program? Please identify yourself in the chat box. See, in the healthcare setting, more likely those organisms will be able to survive who are resistant to most of the organisms. So that means if a patient is developing some infection in the healthcare setting, it is difficult to control that. It is important we are preventing and we are able to detect that infection early. And also we have to take measures to reduce patient stay in the organization. So we have to take actions on all these things. Okay, Dr. Ravi Kumar, please unmute yourself.
Yes, sir.
Dr. Ravi, where are you from?
I am from Bangalore.
Bangalore. Which institution?
I was working in NIMHANS.
Okay.
At present, I am in Kidwa Institute of Oncology.
Okay, right. Thank you.
Thank
So
you, sir.
I think you will agree with us. This early control, early detection of the infection and proper management, and it is better, it is prevented at the first step, this infection. Now, what is the impact of this healthcare associated infection? It has impact on patient. It is emotional stress for the patient. Patient is thinking after surgery, I will be recovered from my illness and I will be able to carry out my routine activities. But after that surgery, or during otherwise his or her stay in the organization, they are developing some infection. It is a lot of emotional stress for the patient. Now I have to be in this hospital for 2 more days, whether I will be able to recover or not. And they develop some disability also, not permanent, maybe transitory, but it is a lot of stress on the patient. It may lead to some disabling condition, which reduces the quality of life. If suppose somebody develops serious kidney infection and the patient is not able to recover completely from that, or they develop some meningitis, they are not able to recover completely, or they develop some lung infection, and increases the length of stay, which leads to increased cost to the patient. So these are different impacts on community also, because organism causing healthcare associated infection can be transmitted to the community through discharged patient, through staff, through visitors. So there is burden on the community. And as I said, most of the organisms which are able to survive, these are multi-drug resistant organisms. These are triggering community acquired drug resistant infection. Then their impact on healthcare associated infection, on public health system. These are potentially preventable conditions. So nowadays we are talking a lot about this, and more funds are diverted. So this is the responsibility of government, as well as responsibility of healthcare organization, as well as responsibility of people who are visiting these healthcare organization. They are taking appropriate action. But this allocating fund is responsibility of government and healthcare organization. But if there is more healthcare associated infection, unnecessary, this is contributing to imbalance between resource allocation and healthcare. Because now part of the resource additional part of the resource is diverted towards the infection part. We have to be very careful about certain things: hand hygiene, personal protective equipment, prevention of needle stick or sharp injury, good housekeeping. We shall have procedures for all these things. Certain information, these are pasted on the wall. Environmental cleaning and spill management. Source segregation of biomedical waste, where you are collecting, at that point only, these are collected in separate container. People have adequate knowledge about this biomedical waste collection, and this segregation shall be maintained at all levels till the disposal. For government, we discussed earlier also infection prevention and control programs. So we shall have national patient safety policy and program. We shall have infection prevention and control policy, as I said. So for that, you can take the help of WHO technical guidance. This I am repeating just to put more emphasis on this. So I will not read the whole. So what I mean to say, infection is required at the level of government to look into infection prevention and control. Certain regulatory mechanisms, certain surveillance mechanisms shall also be developed. Then healthcare facility also. They designate some person, as we discussed earlier also. They are implementing infection prevention and control policy. They are developing committee for this infection prevention and control. Antibiotic stewardship is very important. Proper biomedical waste management is very important. So there should be a lot of education, lot of training of all healthcare workers for all these aspects: infection prevention and control, antibiotic stewardship, biomedical waste management. And whatever we said, hand hygiene, personal protective equipment, needle stick injury, for all these things also a proper training is required. Then use of diagnostic tests to strengthen early and accurate pathogen identification and antimicrobial resistance. Because this is important. These days, you are getting a lot of cases of rifampicin resistant tuberculosis, carbapenem resistant different organisms. So, one thing is pathogen identification, then antimicrobial resistance identification, so that you can guide effective and safe patient treatment. You are using right drug in the right dose for the right duration. Because in different situations, drugs are different, their doses are different, and duration is also different. Good leadership is required, a good team to develop processes for the segregation, transportation, and disposal of infectious waste. We need infection at the level of government. We need action at the level of healthcare facilities. We need action at the level of stakeholders, different organizations, like as I said, IMA, different state organizations, they are coming forward for the control of all these things. They are creating awareness through their forums. NGOs are creating awareness through their forum, and also encourage accountability. And also publicly are reporting this data so that everyone understands that there is improvement or this thing is happening. So everyone has to see that they are taking appropriate action, and this is at the level of, at the international level also. You can say when we are talking international level, so we are talking about what is the action at the WHO level, what is the action at the UNICEF level, or through some other international organizations. So they are also coordinating various activities. They are also contributing for all these things through different meetings involving different governments or representatives from different organs, uh, different organization. And this antimicrobial resistance, including this healthcare associated infection, very important. This is a global challenge. So we need some international guidance document for this. So at international level, national level, healthcare organization level, and stakeholders level, at every level, we need a lot of efforts to address all these things. When a patient is admitted in the organization, healthcare organization, sometimes they may develop some problem not related to exactly their disease state. They may fell from the stretcher, from the bed. They may develop pressure ulcers, or they may develop thromboembolism. So for this, again, see, you must have seen in this standard, the you will find these term processes. Certain things I have taken from ISO 7101. They are saying processes. Process means sequence of activity, and for each activity, you need a documented procedure. So you shall have processes in place to prevent patient fall, pressure ulcer, and thromboembolism. Because if these things are not taken adequate care about, the patient may develop some problem which is not related to their health. One thing is healthcare associated infection that is not related to their actual illness. They are developing problem in the healthcare organization. These things also, if which are preventable, if prevented properly, so again, there is no compromise in their health because of all these things. To identify patients who are at risk of pressure injuries and establish the necessary control needed to minimize the risk factors. Define interventions to maintain skin integrity and periodically evaluate the implementation and results of the intervention. How you will prevent pressure ulcer, how you will prevent thromboembolism, how you will prevent fall of the patient. So for this, whatever latest technology available, you are following that to prevent the fall. You are keeping appropriate support in the wheelchair, in the stretcher, in the patient bed, if there is any such risk situation. For thromboembolism also, you shall have protocols for the prevention and treatment. And for this, documented pharmacological protocol for the prevention of thromboembolism that is evidence-based. So for patient fall, pressure ulcer, thromboembolism, you have to take appropriate measure to prevent them. For healthcare associated infection and antimicrobial resistance, biomedical waste management, you shall have processes to adequately take care of all these things. Right? So now what we will do, we will have, because we are discussing for last almost 2 hours or maybe 10-15 minutes, less than 2 hours, we will have 10-minute break and then we will start again. We will start exactly at 11:30. Is it okay?